Hey, welcome back to another video. I'm Kavita Deva, a skin expert, consultant, and a cosmetic dermatologist. The topic we are going to talk on today is a very common yet distressing skin condition. The skin looks flushed and red all the time, especially to your skincare products. You may at times get confused with the photodamaged or sunburned skin, eczema or contact dermatitis, or even to your severe acne prone skin. So what are we talking about today? So we are going to talk all about an under recognized skin condition called rosacea. Rosacea is a long-term inflammatory skin condition that affects mainly face and is observed in people with the lighter skin. It can also develop in African Asian. Though the precise cause of rosacea is not known, but it could be a combination of your hereditary or the environmental reasons, which could be a potential risk factors. In addition to them, there can be many other factors which can exacerbate rosacea, like your vascular dysfunction, angiogenesis, where there can be a growth of new blood vessels which promotes a lot of redness on the surface. Could be due to the Demodex folliculamide. Could also be due to H. pylori, which is a bacteria found in your intestine. There's an overabundance of a protein called cathelicidin cause a lot of redness and swelling on the skin. And some of the other causes for the inflammation on the skin can be extreme weather conditions like extreme hot and cold climate, strong wind, severe sunburn, heavy exercising, alcohol, especially your red wine, spicy food, stress, anxiety, and sometimes hormones like your menopausal flushing is responsible for exacerbating rosacea. You can see red patches or textural changes on the face, especially in the central zone of your face, like your cheeks, your nose, forehead, and chin. It's usually diagnosed in women with the age group of 30 to 50 years old. This is a condition which, if left untreated, can become really worse. So let's understand what are the different types of rosacea, what skincare is right for you, what are the causes and its treatment, and what should you do to avoid it. So rosacea can be categorized in 4 different subtypes with different severity and sometimes even overlapping conditions. And each subtype is the progression from a milder to a more severe subtype. So it's important to diagnose and treat it early. And remember, each subtype requires different treatments, so there is no one size which fits all. So let's start with the first subtype, which is erythematotelangiectatic rosacea, which is also known as a vascular rosacea. So what triggers erythematotelangiectatic rosacea or a vascular rosacea? So it starts gradually with the occasional flushing and also visible broken capillaries. There's stinging and burning sensation, and also at times skin is swollen. With the things which have triggered it, like your alcohol, especially your red wine and whiskey, which can cause a lot of flushing and redness on the skin, or your spicy food, and also some dairy products like cheese. But if it's left untreated over the period of time, it becomes persistent and then it stays. It's associated with intense redness on the skin and frequent flushing of the skin. You have to remember, rosacea can be treated, it cannot be cured. So you need to prevent it from getting it worse by identifying the things which are causing rosacea to flare up. Be cautious, or be aware of what you're eating. Avoid cleansers and cream which have alcohol, like your isopropyl, your ethanol, and also your product should not have any kind of a fragrance. It should be fragrance free. Ingredients which have witch hazel, camphor, menthol, so anything minty which can really irritate the skin should be avoided in a rosacea prone skin. So, and also wearing of your sunscreen is very important to keep your rosacea under control. Make sure that your sunscreen doesn't have any kind of a fragrance. Use a broad spectrum physical sunscreen which has ingredients like your titanium dioxide, zinc oxide, which are physical UV blockers, and it should be of SPF 30 or above. Also avoid using any AHA products like your glycolic acids or your even lactic acids. Instead, you can go with the BHA based cleansers, which are less irritating to the skin, and also it's good to control excess oil and for even open pores. If you're looking for a collagen buildup or for minimizing your fine lines and wrinkles, you can try plant-based ingredient bakuchiol, which is a good substitute for vitamin A for retinol-based product. But if your skin can tolerate retinol, there's no harm in applying retinols. But I would suggest go with retinaldehyde, which is less inflammatory and less irritating to the skin compared to the other forms of retinoids. Another thing which you can do to camouflage your redness, if you remember the color wheel where the opposite colors cut down the other color, like opposite to red is green. To cut down the red tone of your skin, apply the green tinted moisturizers or even your sunblocks. There are many sunblock which comes with the green tint, especially for the rosacea prone skin. Okay, so that was the first subtype, erythematotelangiectatic rosacea. So now we come to the second subtype of rosacea, and it's called papillopustular rosacea, which is also called as acne rosacea. Now this is a progressive stage of the first subtype and is more inflammatory stage, is most commonly misdiagnosed and mistreated as acne. So the very common difference between the classical acne rosacea, is that there are no comedones and the skin is accompanied with a lot of redness. The symptoms of acne rosacea is that there are acne-like breakouts with a lot of redness on the surface. The acne breakouts are not as persistent, they come and go. The skin is very oily and sensitive. The skin may burn and sting. Sometimes acne breakouts are also accompanied by broken capillaries or spider webs. So it's been observed that acne rosacea could be due to the presence of Demodex mites, which is present mainly in the hair follicle and in your sebaceous glands, and when their population grows can lead to inflammation on the skin. Another reason could be the presence of the bacteria called H. pylori, which is found in the intestine. In acne rosacea, you'll notice the persistent erythema or redness mainly on the central zone of your face. You have to be careful while treating acne rosacea. There are not many products or ingredients which you can see over the counter, but some of over the counter products which you can really go for are sulfur, which is a very underrated ingredient. So this is the ingredient which is tried and tested and has been used for many years now in treating acne and inflamed skin. Sulfur is very good in controlling the redness of the skin and also drying up of acne. Another ingredient which is fantastic, which is very good in controlling inflammation, redness and also acne, is azelaic acid. Azelaic acid is very good in calming down the erythema, the redness of the skin, and along with controlling the acne growth, it also helps in skin brightening. Some of the other ingredients are licorice extract, your green tea. So these are some of the ingredients which you can look for in controlling rosacea as well as acne. And with all these over-the-counter products, if it's not helping you, you definitely have to seek the professional advice to treat your acne rosacea. Your dermatologist may prescribe you some of the oral antibiotics like tetracycline, doxycycline, and if none of these prescribed medicines are helping you, you may have to go with isotretinoin. So the third subcategory of rosacea is phymatous, which is also known as rhinophyma. As the name suggests, rhino means this rosacea is generally seen on your nose, where the skin becomes quite thick and red and have large nodules. This problem occurs if your rosacea have been left untreated for a very long period of time. The sebaceous gland, your oil glands, keeps growing in size and your skin looks very bumpy because of the large nodules under the surface of the skin, and your nose becomes too thick and irregular, and you can also see large pores on the skin. So phymatous is commonly seen in men. Unfortunately, you can't do much without the professional's intervention. The treatment which is really beneficial in treating phymatous rosacea can be your topical antibiotic like isotretinoin, Even laser resurfacing is good to treat nodules. And if the problem is really severe, you might have to go with the surgical intervention. So the last and the fourth subcategory of rosacea is ocular rosacea, which is related to your eyes. This subtype, as the name suggests, affects the area around your eyes. So quite often this particular rosacea goes untreated because it is misdiagnosed as some kind of a eye allergy. The symptoms of eye rosacea are gritty eyes. There will be stinging, burning sensation in the eyes. The eyes will become really red and sometimes even watery, and the eyelids are swollen. There can be a cyst on the eyelids. You might have a blurry vision. Eyes are quite itchy and dry. So the best way of not delaying treating your rosacea is by recognizing it early. When you start experiencing stinging and burning sensation, when the flushing comes and goes, when there's a wave of flushing, all the symptoms are denoting that you are suffering from rosacea. So it's important to diagnose it right and identifying which subcategory of rosacea your problem is in to give you a correct treatment. The rosacea symptoms may come and go. They might flare up for a few weeks and then fade altogether completely and then might come back again. So it's in a form of wave. So what is important is to see your skin expert or a dermatologist to identify what subcategory of rosacea your problem is in, to start your treatment early, because as I said earlier, there is no cure. So best is to prevent and treat it in the early stages of rosacea before it becomes permanent and stays. Remember, with treatment or prevention, you can reduce the signs of rosacea but cannot eliminate it. You can ease your discomfort and also prevent rosacea from worsening. I hope from this video you have learned a lot about rosacea, about its treatment and how you can avoid it having it in the first place. Thank you so much for watching. Leave any comments if you have anything related to this video in the comment section below. Don't forget to subscribe my channel and please press the bell icon so you are the first one to be notified when the new video is uploaded. Till then, take care of your skin. Bye bye.